Hello, I'm Dr. Sundari Mase, Sonoma County Health Officer, and I'm here to share the latest updates on coronavirus in Sonoma County with you. As of yesterday, June 28th, we have 1,118 confirmed cases, up 26 cases in the last 24 hours. 493 are active, 620 have recovered, and we still have the 5 deaths that we reported. We've now performed almost 47,000 coronavirus tests, and the rate of positive cases is still less than 8%. And that's an average over the past 7 days. Today, I'd like to talk to you about contact tracing and address some concerns that people might have. First, I'll just provide a brief overview of what contact tracing is. Contact tracing is an important way to prevent the spread of COVID-19. People who've been in close contact with someone who's tested positive are identified, they are high risk, and they can then be tested and followed. The work of contact tracing is done by the public health staff who have expertise in disease control. So the process starts when someone is diagnosed with COVID-19. Our staff, public health nurses, then interview that person who has COVID to find out where they've been and who they've had contact with, so they can determine who is a close contact and at high risk. Now, close contact isn't just someone they passed by on the sidewalk, it's someone that they've had prolonged close interaction with, usually 15 minutes or more. This usually includes people in the household and other situations where they exposed persons with no facial coverings and where 6-foot distance was not maintained. These conditions, of course, define their interactions as higher risk. Staff then attempt to notify these people about their potential exposure to someone with COVID-19. Now, what's important to know here is that outreach to contacts is done without sharing the identity of the person who may have exposed them and who has COVID. So we do maintain confidentiality. During notification phone calls, contacts receive information about COVID-19 symptoms and a referral for free testing. Confirmed close contacts are instructed to self-quarantine, that is, stay in their homes to prevent further spread of disease. During that quarantine period, the contact may receive a phone call from the county's public health staff to ask if they're experiencing any symptoms. Quarantine lasts for a period of 14 days. I want to assure you that for everyone involved in this process, personal information is strictly confidential and is not shared with other governmental agencies or immigration officials. The county maintains strict compliance with health information privacy rules, such as HIPAA laws. The county is aware that not everyone has a place to effectively quarantine while waiting for their test results or isolate if they test positive. These measures to separate from others are critical to stopping the spread of the disease. To support this effort, the county is able to use Sonoma State student dorms as a place for individuals and family members to safely and comfortably separate themselves from others in the household. Those accommodations, meals, and Wi-Fi are provided free of any charge. People are assigned to one dorm room separate with a separate bathroom during an isolation or quarantine period. Of course, many people are concerned about work and daily activities if they have to be in quarantine or isolation. The county can help find resources to meet your specific needs, including how to manage loss of income, pay rent, purchase or obtain food, medicines, and other essentials. Visit the Finance and Housing Assistance page on socoemergency.org for more information. Today, we have a community question. All across the country, we're seeing the virus spike. And here too, the numbers are growing rapidly. Will we have to close back up if this continues? Our approach has always been data-driven, meaning that we follow a number of indicators closely to make these decisions. The indicators I watch most are the transmission rate, hospitalizations, and morbidity. If our hospitals become overwhelmed, we may need to rethink how best to contain the virus locally. That said, with the volume of contact tracers we now have in place, we're better positioned to understand how and when the virus is spreading. So we have greater capacity with this crucial containment strategy to address the rise that we're seeing. My goal is to not go backward, to keep businesses open and isolate the hotspots as they are discovered, to close businesses or activities individually only when necessary. Lastly, I'll add that while this virus is new, the tenets of disease control, like contact tracing, are not. COVID-19 is highly transmissible. We're learning more every day, which is why we're throwing everything we've got at it. Keep doing your part to control this disease. Stay home as much as possible. Wear your facial covering. Wash your hands. Keep physical distancing. It's what we know can tame this virus. Signing off, wishing you all good health and safety. Talk to you again on Wednesday.